If you're getting knee pain after running, this is the video for you. We're gonna go over the 3 most simple things that you can do on your own from home to fix that pain from happening the next time that you run. First thing that you wanna check is, are your shoes horrible? What I mean by that is you wanna be looking at your shoes. Are your shoes just overworn or are they just really poor shoes? So whenever I'm looking at somebody that's running a lot, doing a lot of training, I typically tell them that between 3 to 5 months is how long the typical shoe will last before it really starts to break down and have an effect on your knee, your mechanics while you run. So for me, I need more of a stability shoe. I would say the majority of people out there, this is my personal opinion, and I may get some flack for it, but I think the majority of people could really benefit from a stability shoe. And what I mean by that with a stability shoe is it bends in the forefoot, and then it's pretty stable here in the middle. You can't really bend it. It's got a nice stable heel as well. And then so when I'm running, I have that support through my foot and I don't get a lot of variance through my knee, which is gonna cause it to get more torque through that knee and more torsion, which can cause more irritation and more inflammation and more pain. So first thing, look at your shoes, and if they're really worn or they've exhausted their life, then it's time to get a new one. And you may want to look at getting more of a stable shoe for that knee pain. This is what a horrible shoe would look like if you're running. So anything that you can do like this, I'm not a huge fan of. There's a big movement for stability shoes right now, and I think that's great, but it's for a select population of people that it can be really beneficial. If you're looking to get rid of your knee pain and you're having active knee pain while you're running or after you're done running, I don't suggest that you switch to minimalist shoes. I think it's something that you progress slowly into and then you start training slowly into. Something else that you want to assess, are your hips really tight? Now your hip tightness can impact how your knee moves and ultimately the mechanics of your entire lower extremity. So it's really important that we look at how are your hips moving. So to do that, all you're going to do is you're going to sit down on the edge of a table or a chair, and I want you to, one, try to stick your leg out to the side, keep your thigh down and stick your leg out. See how far out it goes. Now do it on the other side. If you notice, this leg doesn't go nearly as far as that one. So it's here on that side and here on that side. So I've got a lot more internal rotation on this leg. Now if I want to assess external rotation of my hip, I'm going to bring up my foot like this and I'm paying attention to how high up is this knee. Okay, now I'm looking over here and what I've noticed is I'm a lot tighter on this side as well. So my knee's sitting up higher here, and it doesn't go as far out on this side as it does over here. So that tells me right away that if I'm gonna have knee pain, it's more likely gonna happen on the left side. If you discovered that you're tight in your hip external rotators, so this exercise, and one side is tighter than the other, meaning that leg, that knee is sitting up higher, then this is the stretch that you need to do to loosen it up. Throw that leg up on a countertop on the edge of your couch, and you get your foot right out in front of you, and it should be in parallel line with your hips here. Now what I'm gonna do is I'm gonna lean over that knee, and I'm gonna lean this way, or this way. It's wherever you feel the biggest stretch in your hip, okay? So I'm gonna get down into it, and I'm gonna feel the biggest stretch going this way for me personally. I'm gonna hold it for about 30 seconds, and then I'm gonna relax, and I'm gonna do that 5 times, okay? Now if you found that you're tighter in hip external rotation this way, then you're gonna do this stretch next. You're gonna get on the floor, and if you have limited internal rotation on your left side, you're gonna be putting that leg behind you, okay? So my internal rotation is limited on my left side, so I'm gonna bend that knee about 90 degrees and get that back behind me as far as I can. I'm gonna bend this knee at 90 degrees, and I'm gonna try to sit upright. Already I'm starting to feel a pull in my groin. Now, I want to stay upright. You're gonna rotate your shoulders, your trunk in a direction until you feel a good little stretch throughout that hip. Now, you may notice a little bit of cramping or your tightness in your legs, and that's totally normal. Now, just make sure you're not like on a hard surface like a tile or a hardwood floor, else this isn't gonna feel very good. So I'm sitting upright like this. Now with this hind leg, I'm gonna push that foot down into the ground, okay? So I'm gonna push as if I'm trying to push that floor away. This is called a muscle energy technique. And then I relax and I go right back into it. I'm pushing down towards the floor with this foot. I just do that for about 3 to 5 seconds, and then I relax. And you'll start noticing that this stretch in here is kind of giving way a little bit. So I'm actually gonna rotate my shoulders away and get a little bit more of a pull down here. And I'm gonna keep pushing down with that foot down towards the floor and then relax. And each time I relax, I try to sink into that stretch more and more. Well, now I'm actually going to try to lift this foot up towards the ceiling to continue that muscle energy technique to help to get my hip internal rotation to release even more. So I'm going to lift that hip up. It's not going to feel like you can do anything at all. For most people, they can't even lift their foot up like me. And then I just do it for 3 to 5 seconds and then relax. And then I rotate into that stretch even more. And I feel it really loosening up. I'm going to lift it up again, lift, and relax and rotate into that stretch. And I really feel like I've gotten a good release on those hip internal rotators. Do this stretch 5 times in each direction. So what I mean by that is 5 times pushing up and then relaxing, and then 5 times pushing down and relaxing. The third piece is check out to see if your hips are really weak. Now, the best way to do this is just by doing some movements. And this looks really simple, but it's actually really hard. Okay, so you're gonna lie on your side. You're gonna keep your hips straight up and down so they're perpendicular to the ground. Turn that top foot down towards the floor so the toes are pointing down. And I'm gonna try to lift my leg 30 times. Now, if you can lift your leg 30 times and you're not dying by the end of it, then that means that your hips, your glute medius and minimus is actually really strong and you have good stamina in that area. So a lot of people who have knee pain, they have really weak hips. And you can do a ton of squats, you can do a lot of different leg exercises, but a lot of them don't target that gluteus medius and minimus on the side. And so there's a lot of research that indicates that a lot of runners and people that are active, or just people that aren't even active, that have that weakness there, it's a big indicator and a big leading factor to their knee pain. So I'm getting a huge burn here. I haven't even done 30, I've probably done 20. And so if you're weak in that area, guess what you do about it? You do a ton of those leg lifts. You want those hips straight up and down, so that's why you turn that toe down towards the ground. Then you're just gonna lift that leg up and down, and you're gonna try to do as many as you can to failure until you can't do anymore. So typically around the 20 mark, and then I would do 5 sets of that. Your hips are gonna be on fire. It's gonna be great for your glutes. It's gonna be great for your running pain, and keep that pain from coming back. And why does hip weakness impact running pain? It's because if you're weak here, then you're gonna shift in your hips when you move. So if I lift this leg up and I don't have the stability here to support the rest of my trunk, then I'm typically gonna get some torsion through here. And guess where that torsion goes? It goes right into my knee, and I can get it to deviate in, deviate out, then it puts an abnormal stress across that joint, and that causes a lot of knee pain. If you've been having knee pain for more than a month, then it's time to do our online knee rehab course. It goes through everything that you need to know from a treatment standpoint, how you treat it on your own from home, all the exercises that you need to know, and all the stretches. It can definitely help you get over that hump that you've been facing. Don't forget to tune in to our YouTube live sessions every Wednesday at 9 a.m. Eastern Standard Time, and that's where I answer any of your questions live. You can interact with me and ask any questions you've got, and you guys have a great rest of the day.